Here is our beautiful patient, you guys. We're going to do lip filler for her. We're going to do this in a very natural way. That is my thing. Naturallookinglips.com. That is my way to do lip injections, okay? I do that in certain ways that I'm going to kind of go over in this video. But the first thing we're going to do is we're going to numb up the area. We want to numb up the area because it lowers the blood pressure. Make sure your provider numbs the area appropriately, because you're going to have a much more pleasant experience. Much less likely to get bruising as well, okay? So we're going to clean off the area with alcohol. So go ahead and rest your head back. Perfect. Cleaning up any, so if you're going to come in for your appointment, don't put a whole lot of makeup on. It doesn't take much, and this will start to kick in. What we really want is we want to feel like our lips are in a different planet. And now the beautiful thing is the injections have numbing medicine in it as well. So as we inject it, it actually gets even more numb. But right now, our patient, we're going to focus on kind of the corners, the top lip, and just a touch on the bottom lip for overall natural looking appearance. And I'll show you that as we go. So the product I like to use is called Juvederm, and it's a hyaluronic acid. It lasts anywhere from 6 to 12 months. You can use any kind of hyaluronic acid-based filler. Restylane also another one. I just find Juvederm lasts a little bit longer for me. So our goal for your lips is to do overall volumization in a very natural way. So you have a beautiful Cupid's bow. A lot of people make the mistake and they'll do a sausage lip formation here by blunting this, by going into this vermilion border. We don't want to do that. We want to stay in the vermilion under here and kind of uplift and outwardly naturally modify the lip so that you don't get sausage shaped lips. That's a very unnatural look. So we're going to do that in a way to bring out her corners, the fullness of the upper lip naturally, and then a touch on the bottom lip, because her bottom lip is actually looking pretty good already. So we're just going to use a smidgen down there. Cool. We're going to get started, and then make sure you take a deep breath in and exhale slowly through the nose. Good. All right, just keep breathing through your nose. You want to breathe through it if you feel any kind of sensations that you don't like. A little pinch. Perfect. How's that?
Very painless.
Good. So I'm just going to kind of move back and forth. So we're going right in the vermilion border. You don't want to do any edge defining techniques because they end up blunting that and scarring that area over time. You want to preserve that junction and not mess with it. Also, the lip filler will migrate. If you put it right into this border, it'll migrate up. So your lips will end up looking like Homer Simpson. We don't want that. We want to stay in the vermilion, have it underneath there, so that we don't mess with this junction that's right on the border of the skin versus the vermilion, which is the red portion. All right, so I'm just gonna kind of do a little check-in to see where the filler is. You doing okay, good?
Yeah.
All right, great. And let that numbing medicine kick in just a little bit more. Tiny little pinch here. Now I'm gonna do some Cupid bow highlighting. A little pinch here and here. Okay, and then we do a tiny bit in the center. This one kind of stings always a little bit. Okay, a little pinch. Beautiful. Kind of take a step back, and I always check for balance. Okay, balance out pretty good. I think I need to put a touch bit more on this side. Give it a little more volume, and then we'll adjust the bottom lip. When I first started doing lip injections, it used to take me about 45 minutes. I've done thousands of them at this point, so it doesn't take me quite as long. But again, you really want someone who's kind of efficient and knows what they're doing, because as we go, the lip starts to swell. And if it swells up too much, you lose the anatomical borders and landmarks, and it makes it harder. So you want someone who's efficient and does this on a regular basis, but not too fast where it's really painful. Okay, now we're gonna do the bottom lip here, a little pinch. We don't want to forget about the corners. So overall, how's the pain feeling?
I haven't felt anything. I felt a little in the center, the part that you said might sting, but
Yeah.
other than that, nothing.
Previously, you had your lips done before, right?
And it hurt. Like,
It hurt a lot,
felt
right?
like needles everywhere.
Yeah, exactly. This
And I numbed a lot longer.
last time?
Yeah.
Yeah, this stuff is amazing. It's our little secret. Now, it's very important that your provider always massages after providing the filler, okay? Because even though I inject it very evenly, there still could be little lumps and bumps in here that we want to kind of smooth out, all right? This takes time. It's not about cutting corners when it comes to your face, okay? You want somebody who takes the time to kind of massage all this stuff in appropriately, and then guess what? You might even actually need to do this at home as well, because filler takes about 2 weeks to set in, but once it sets in, it gets much harder to massage. Now we're gonna massage in the upper lip here. It's totally getting in there, but it's It's really important. It's kind of like going to the dentist office. I'm actually applying a lot of force, but now's the time to do it because her lips are completely numb. Now that was about 1 cc of filler. I never want to try to do too much filler at one time. Occasionally, the most I've ever done was 2 cc's at one time. But the best way to do this is just to kind of add a little filler, wait a couple weeks, and add a little bit more if we need to. But I think this is actually a totally good amount for her for the next 6 months. Let me know what you think.
It looks really good. It is really natural. I like it a lot.
Good. All right. So that's it for our natural lip augmentation, you guys. So a couple key things I just want to remind you of. Go to a qualified injector. We stayed within the boundaries of the Vermilion. We didn't do any crazy different types of injections. We made sure that the procedure was painless for her. And then we did lots of massage at the end. Okay, results typically last 6 months to 12 months. And there can be a little bit of bruising, so don't do this before your wedding night. Give us a few weeks at the minimum before an important event. If you have any other questions about lip filler, feel free to check out our website, naturallookinglips.com, and feel free to leave your comments, questions, feedback right here on my YouTube page. If you like what you saw, make sure to give me a thumbs up and subscribe. Thanks so much.